Welcome to the tutorial which is on the urine drug screening request and history taking. So the instruction to the candidate is you've been asked to see Mr. Robert Jones, who is a 25-year-old gentleman known with paranoid schizophrenia. He's recently gone on leave and the nursing staff are concerned as he's now presenting with a deterioration in his mental state. The task for the candidate is to talk to him and get a history, and to request a urine sample for drug screening. The key bullet points and the mental checklist which I would like you to bear in mind and jot down are the following 5 points. So number 1 is you would need to establish the details around his admission. Number 2, you want to find out more about the leave. Number 3 is you want to assess what his mental state is. Number 4, you could do a risk assessment. And number 5, finally, you want to request the urine sample. The key communication skills in this station is important, as it is a relatively simple station, but there are some tricks which you need to know before you do the station. The scenario you are faced with is that you are seeing a young gentleman already with a firm diagnosis of schizophrenia, who's been on leave and has taken some cannabis and thus has shown some deterioration in his mental state. He is initially reluctant to talk to you and possibly to divulge any further information, and this could be related to his mental state. In addition, as you are requesting a urine drug screening, it's possible that he believes that you are part of a conspiracy with the nursing staff and has no trust in you, and therefore might not want to give you a urine drug screening, as he's not sure what you're going to be using his urine sample for. So as you can see, you're dealing with a lot of factors related to mental state, drug and alcohol use, and also other anxieties around giving a urine sample. So it's important that in that first 2 minutes you build rapport with him, gain some trust, and show some sensitivity and empathy, and understand the subjective feeling of what he's going through. A suggested approach and introduction would therefore be the following. Hello, Mr. Jones. Thank you for seeing me today. I understand from the nursing staff you've been on leave, and I've now come to see you today to talk to you about that, why you've been in hospital, and also to ask you for urine sample. Is it alright if I ask you a few questions? So number 1 is you want to establish the history of the presenting complaint. So you need to ask Mr. Jones how long he's been in hospital for, what's his diagnosis, what were the circumstances and the precipitators around his current admission, whether this is a formal or informal admission, and what are the current medication that he is taking. You also want to establish what symptoms he had at the time of admission and whether they've improved or not. Thereafter, you would move on to the second bullet point, which is to find out the details about the leave. So you want to know whether he's been on leave, for how long he went on leave, whether it was escorted or unescorted leave, and whether he had any access to any drug and alcohol during the time of his leave. Thereafter, you would move on to the third bullet point to establish what his mental state is like. So to elicit any delusional beliefs he might have, any hallucinations, and to assess for any first rank symptoms which might be present in someone with schizophrenia. Thereafter, you would move on to the fourth bullet point, which is doing a risk assessment. So you want to establish whether he has risk of wanting to harm himself or others, whether any of the psychotic symptoms could indicate any threat or override symptoms and command hallucinations, and any other risk in terms of absconsion which might be important. Also, Part of the risk assessment would be any ongoing access to any drug or alcohol which could potentially affect his mental state. So once you've established all of this, you would then move on to the fifth and final bullet point of building up your case towards asking him for the urine drug screening. And then summarize. A summary could be the following. Thank you, Mr. Jones, for talking to me. From what we've discussed is that you've been on the ward, and as a result of your relapse in your illness of paranoid schizophrenia. There's been recent changes made to your medication. However, you've been on leave, and since returning, you have also noticed an increase in your symptoms. You've also told me that you've had some cannabis while on leave. I would like to ask you whether we can have a urine sample so we can test for any drugs that you could have taken, as this is part of our ward policy and in no way is related or meant to cause you any harm or distress. Thank you.